Hey guys, it's Paul Helms from Helms Performance. So today I'll be talking about several drills that you can do to prevent and start rehabbing low back pain. So this is a common injury that I see while working with athletes, everyday folk, and it's pretty pervasive in modern society because we sit a lot, our posture is generally poor, but also our breathing is usually inhibited in a very fundamental way. Your diaphragm usually is not turning on. And this is because, as most of us live, we're seated, we're slouching forward, so this causes a lot of pressure to be pressing up on the diaphragm, and that's going to be stopping it from breathing and then expanding downward. As that diaphragm can expand, other muscles have to compensate. So secondary breathing muscles in your chest and neck start to really engage, turn on. They tighten up, pull your head forward, pull your shoulders forward, and then this is reinforced by bad posture while we're sitting and then slouching right here. So, 3 things that we can do. The first one is just learning how to use your diaphragmatic breath again. So breathe from your belly, not from your chest. These muscles should only be turned on during times of extreme stress, whether it's you found out that you have a deadline in an hour or being chased by a lion on the Serengeti. So let's go over this. So standing tall, I'm going to imagine like there's a chain pulling upwards from my skull, lengthening my entire body straight up. I'm going to place one hand on my belly and one hand on my chest. These are sensors. Ideally, my top hand shouldn't feel any movement occurring from my chest, so no chest breathing, but my bottom hand is going to be pushed forward by my stomach as my diaphragm presses down and presses my guts down. So standing tall, I'm just going to take a few breaths by inhaling and exhaling. Inhale, exhale, inhale, and exhale. Good. So something that I highly recommend that you practice every day. Most of my clients, I recommend every hour you stand up from your desk, take 10 good belly breaths. And don't try to breathe really deeply. Just try to breathe so that you feel that belly move. It's going to feel very strange at first because you're reinforcing a new movement. That's not normal for your breathing pattern, but also you're strengthening a muscle and loosening it up after probably many years of disuse. All right, so that's the first main drill. Second one is going to be, how do we brace your midsection? How do we pressurize the entire lumbar region right here? Because we need to pressurize from bottom of your ribs to top of your pelvis in order to make sure that your lower back stays safe. Because most of us, if we don't pressurize through here using that natural weight belt muscle, then all we're using are this narrow range of extensors here. So it's trying to stabilize with a pie wedge what should be stabilized with a column. All right, so to do this, you're just going to find a surface, lay on it face up, knees are bent, and then I'm just going to place my hands on my stomach. I'm going to press my low back down so I feel these lateral abdominal muscles engage, holding this lateral tension. I'm just going to take some shallow belly breaths. Nice and easy. Then lateral tension, not front tension. I feel front tension, that's the wrong muscle engaging. I want lateral tension. Using the same belly breaths that I just showed you. All right, so that's for engaging that deeper abdominal muscle. Now, let's apply this to a more realistic posture, something that we're doing every day. Because along with breathing dysfunction, that also leads to pelvic misalignment. That's going to be causing a lot of that compressive force that most folks get low back injuries from. So standing tall, I like to cue it with my hands. So first I'm going to squeeze my butt really tight. That aligns my pelvis in the right spot that I need it to. Then I'm going to inhale and tense, just like I did on the table, but I'm tensing while standing. So I feel that lateral tension here and here. Holding that tension in your midsection, slowly allow those glutes to relax. It's going to be really weird at first because you're having to hold tension as you relax another part of your body, but just focus on practicing it consistently. All right. So again, I squeeze my butt, inhale, compress, tighten the midsection, and then I allow my glutes to relax. I'm going to hold that for about 3 seconds and I relax. In advanced methods, you would hold that brace with your glutes relaxed, and then you would do shallow belly breaths. All right, but that's an advanced form. Practice these first 3 drills that are going to be fundamental to realigning your pelvis, decompressing your low back, and then activating all these muscles in your abdominal region that are are needed to pressurize and stabilize your low back, guarding it against injury. All right.